Well, one of the most important things to try to prevent for older adults is an accidental fall. It can threaten their independence, their health, and their life. Joining us this morning with some information on prevention is our daytime cardiologist, Dr. Shobha. Good to have you back.
Good morning.
Well, that's kind of one of those things you hear as people get older. One of the things that's so important is to prevent falls because it leads to so many other things.
That is correct. And falls in the elderly are extremely common, and sometimes they may not tell us or their family members that they have fallen. And so we have to be very careful that, especially if they have fallen once, that increases the risk of falling again. And we have to take every step that we can to prevent it. And there are algorithms that even we can go on. That is the CDC website. You know, you go to CDC and look at falls in the elderly or the falls in the seniors. Awesome website. It has a lot of information on it.
And one of the things it has too is some of the statistics, and you said locally you're seeing that too, where they come in and they're treated for a fall, and then they develop this and then they develop that, and it just starts to escalate.
That's correct. When you fall, you can break a bunch of bones. It could be ribs like we talked about, it could be your shoulders, but the two big things that we have to think about is a fall and fractured hip and brain. You know, you can fall and bonk your head, and especially if some of our older people are on blood thinners, the risk of bleeding inside the brain becomes very high. If you break your hip, their activity level is significantly limited, and the problem with the older people is they are scared that they will fall, so they further decrease their activity, and when that happens, their leg muscles get even weaker, and so they become even more deconditioned. I think the first step is to identify who is at risk for fall. Are they on certain medications that can make them drowsy or weak? Have they had previous strokes? There are some people whose blood pressure drops when they stand up. Some medications can do that, and unfortunately diabetes, which is a very common condition, can do that. The blood pressure drops when you stand up. That is called orthostasis, and that can make people fall. Parkinson's is another disease that can make people fall. So look for medications, look for underlying conditions. Are their leg muscles weak? Are they deconditioned? Do they have osteoporosis? Are they deficient in vitamin D? All of these things can increase the risk for falls. If you see your parents, you know, trying to grab onto things before they stand up, they are unsteady, you know, their balance issues, their vision is not good. Make sure there are no trip hazards in the hallways. Make sure there is lighting at night when they try to get up. There are no rugs, there are no cords, there is enough light when they get up in the middle of the night. There are simple things that we can do. And physical therapy, I mean, awesome. If somebody is weak, getting them gentle exercises so that their leg muscles are strong, how to stand up, maybe sit down first, you know, don't jump up and try to stand up. Sit down first for a few minutes and then gently try to stand up. Putting handlebars, you know, like in the showers. People slip and fall in the shower as well. So there are so many simple things that we can do, and talk to your provider about it. They can put you through the fall risk protocol, see if you can be of assistance. Because when people get admitted to the hospital, it doesn't end there. They go to they go to the cardiac rehab place, and they get super infections, and unfortunately, fall can be a huge cause of death in the elderly, directly or indirectly.
Some really, really good information. You mentioned the CDC's website, and really they had kind of listed out, like you said, the rugs, the cords. Go through your home, check it for those hazards, and take those extra steps. We'll give everybody also, if you need information too on obviously heart issues, you can go to heart.org, or you can check out the CDC website for more information on falling and some of those statistics and risks. Dr. Shobha, great to have you on the show. Thank you for the information.
Thank you very much.
We'll be right back.